Yes.
Welcome back. We're covering current events, and joining me again is Patton and Hannah Salamon-Vegh. Thank you again both for being here. We're going to switch gears now to what to me is a very devastating story. So there's a Quebec man who's a quadriplegic. He had a spinal cord injury. He was experiencing some health concerns, went into the Quebec emergency room, lay in a stretcher for 4 days, and after developing what could be a potentially never-ending or a multi-month treatment for a bed sore, which included an exposed bone, elected, I can't do this anymore, and elected MAID. Hannah, why don't you start us off with this?
Yeah, this is a very sad story, and we're seeing more of this in Canada, that people are electing for medical assistance and dying because they're not able to get the treatments that they need, whether it's surgery or basic things like beds. And he came in for a respiratory virus and then left with a horrific bed sore, and then felt like he could not get it healed. It would just take months and months to get healed. So he opted for this instead. With the type of immigration that we're seeing here in Canada, most people are having difficulty even getting their doctor to give them basic prescriptions that they need, getting referrals and things like that. I'm, experiencing that with my doctor as well. They want you to come in for things that you don't need, and then when you need something, they're like, "Oh, yeah, actually, we can't do that." And part of the reason is because we don't have competition in our healthcare system, because it's socialized. Most private medical options are illegal in Canada. So there's no competition for the government to improve its service, to hire more people. I don't know why more hospitals are not being built, more doctors are not being hired, those types of things. And we're just seeing it continually get worse.
Mike, we keep hearing that sometimes MAID is being accessed by persons who should be easily treatable or should have definitely a quality of life or treatment options. Were you surprised by this case?
This is such a tragic story because one of the issues was that this patient required a specialized type of bed that moves and keeps you from developing bed sores. These beds were in stock in Quebec, and they just never got around to getting one for him, and he developed this catastrophic bed sore, which his doctors, after a number of months basically said, "We don't know that we'll ever be able to fix this, and you're going to be in incredible pain, potentially forever." And it really got to the point where this man felt he had no choice but to seek medically assisted death. And that's not a good situation to be, and it was completely avoidable.
Yeah, it's shocking to me because, in the early days of MAID, medical assistance in dying, aka euthanasia, that we heard that there were concerns over the slippery slope, that people would be accessing this who should otherwise not. And I think in the, what has been 8 years since MAID has been decriminalized or has been legalized, that we have seen these cases. And sure, maybe they're not common, but they happen. Should this man have been able to access MAID? I mean, what are your thoughts? I mean, obviously he's in extreme pain. I feel terrible to hear his bone was exposed. I mean, this is shocking. And again, to your point, Mike, for a simple solution is just getting him the right mattress. Are there enough protections and safeguards, Hannah, for MAID to help people who should probably otherwise maybe be choosing life? Or are we just taking money away from the healthcare system where this man clearly just needed a proper mattress?
Right. Yeah, it's the slippery slope argument has been used to squelch any concerns that MAID would be extended to people with mental health issues or children, things like that. I wrote papers on this in university. I debated my professor on it. He's like, "Oh, that will never happen." And it's like 2 years later, MAID was being extended to people who have mental health issues or chronic pain, regardless of their age. So we see federal resources being put to MAID when they should be put to increasing beds, hiring more doctors and things like that. But when you live in a socialized socialized country, a socialized medical system, there are doctors who are saying, "Oh, it's going to save Canadians millions of dollars a year. The MAID program is going to actually save taxpayers millions of dollars per year because these people are going to be ending their life instead of, quote unquote, taking up spaces in hospitals," which is ridiculous. Like, you're supposed to go to the hospital to get better, not to die.
And sadly, I feel that concept became reality with this case. I mean, this is a man who should have enjoyed a very good life. I mean, yes, he had a spinal cord injury, but he was living, and this devastating 4-day stay basically cut his life short. Inevitably, that's what happened here, Mike. You agree?
This is such a tragic situation because it did not have to happen. The resources were available. the organization within the particular Quebec hospital was just not prepared to do the work to make sure that this patient received the care that he needed, and was left with a very difficult situation, because it doesn't appear that this person was being irrational or had mental health issues. It just got to the point where he couldn't carry
Yes.
on anymore because of the poor treatment he'd received in the hospital.